Hi everyone, I'm Dr. Mara Weinstein. I'm a board-certified dermatologist, and today I'm going to go over the science of aging skin. The first thing to think about is that aging is not a choice. There are both external and internal factors that come into play when we think about aging. So now that you have a better understanding about what happens to the skin as we age in terms of the structure of the face, with the bones changing and resorbing, with the fat pads shifting and shrinking, with the muscles lengthening and thinning, and also with the changes occurring on the skin itself, we can go into what steps to take to address all of these specific changes so that you can age gracefully, not necessarily look like a different person, but just look as good as you feel. That's the most common thing I hear in the office, is that people feel great, they're energetic, they wake up full of life and vigor, but they don't look as great as they feel, and I really want to improve that in a natural looking way. And so that's what we're going to get into right now, is how do we address those changes. I like to call it the 5 R's of anti-aging treatments. The 5 R's are repair, relax, restore, resurface, and redrape. Let's talk about repair first. What do we do to repair the skin? The skin itself, the skin is like the canvas, it's the painting, it's what everybody sees first. And we know that when your skin is speckled, full of brown spots, full of red spots, the tone is uneven. And we know from clinical studies, when you compare a face that is full of sun damage and discoloration and changes in tone to the same face without the sun damage and the changes in tone, basically a clear face to a sun damaged face, there is a 12-year difference that's perceived by blinded viewers. So there was a study where doctors looked at pictures of patients. On one hand, they had a ton of sun damage on their skin. On the other hand, same face, same wrinkling, same age, but they had no sun damage, no brown spots, and the perceived age difference was 12 years. So we know that that canvas of the skin as a starting point is so important to clean up. And so how do we do this? We do this with a skincare routine. So reversing the aging process, or tackling it, or trying to stay ahead of it, or even preventing it, starts with you at home. And that's where skincare comes into play. So there are 3 pillars of skincare that are absolute musts. There's 2 things in the morning and 1 thing at night. And if you just stick to those, you should be able to keep your skin at bay and help to minimize the appearance of brown spots and to improve the overall glow and radiance, so that that part of the aging process is taken out of the picture, because we really don't want something that we can prevent and actually reverse at home to be part of what people perceive our age to be, if that makes sense. So what does that skincare look like? In the morning, when you get up, you're going to want to cleanse your skin. If you're not a big face washer in the morning, that's fine. You can just splash some water. Having water on the skin before you apply products helps improve the absorption of the product. So it's important to just dampen your skin a little bit before you start applying things. So the first thing you're going to want to apply is an antioxidant serum. Typically, this comes in the form of a vitamin C serum. This acts as your shield for the day. This is going to help your skin from free radical damage, which can occur when you are exposed to pollution and UV radiation during the daytime, and even stress. So when your cells become oxidized, they can undergo free radical damage, which then contributes to DNA damage and cell damage, which overall accelerates the signs of aging and leads to the development of brown spots, fine lines, and wrinkles. So if you wear a nice antioxidant every day, it's acting as a shield for the environment and sort of sets you out for the day so that your skin is protected. You can throw in some moisturizers, some hyaluronic acid serums, whatever you need, but make sure you put on your antioxidant. The next thing that's so important to use in the morning, during the daytime, is sunscreen. So when you look for a sunscreen, you're gonna wanna find one that works for you. There are so many different options out there, and we can go into the different choices later. I do have some suggestions in the link below, but essentially you wanna look for something that's SPF 30 or higher, broad spectrum, so it blocks both UVA and UVB rays, and it's going to sit on your face all day. If you're gonna be outside with consistent exposure to the sun, then you're gonna wanna apply that every 2 hours. So in the morning, it's as simple as a vitamin C serum, or antioxidant serum, and sunscreen. And in the evening, I definitely recommend cleansing your face, especially if you're putting on makeup or different products during the day. You're gonna cleanse your face, apply your moisturizers, whatever you need after that. But the one thing you want to do is use a product that has a retinol or peptides in it. And the reason why is because we want to use something that will continue to stimulate collagen and promote cell turnover. Because as I mentioned, as early as age 26, we stop producing collagen, which contributes to a lot of those signs of aging on the surface of the skin and also structurally that I alluded to earlier. So we just talked about repairing sun damage on the skin, which is addressing those changes on the canvas that we can actually do and take care of at home. So it's so important to start the anti-aging process at home. By doing that, you can save a lot of money down the road by making sure that your skin is in good health, which is all about your skincare choices and skincare routine. The second R is relax those muscles. And so what we need to think about is how we can relax the muscles that contribute to etch lines on the face. So the most obvious ones are actually these frown lines, or the 11s, which occur in the glabella. That's the anatomic name for this area of the skin. And over time, as we frown or squint or scowl or make our angry face, we can develop those 11s there. And so we want to treat those so that we don't consistently look angry. There have actually been studies done to show that once you eliminate these 11s or that ability to frown, people actually feel happier. So if you're depressed or angry or, just not feeling good about yourself, by just treating that area, it can really affect your mood, which is fascinating. It's both in the dermatology and the psychology literature. The other lines we can think about relaxing with something like Botox, Xeomin, Dysport, these are all in a category of neuromodulators. The other lines we can think about relaxing with neuromodulators are the lines across the forehead. So I've heard these called all different things like hot dog lines, a barcode, a ton of different funny names, but essentially they are the horizontal lines that develop across the forehead from raising your brows up. A lot of people don't realize this, but they use their forehead muscles often to keep the eyes open. So over time, you might feel like your eyes or your brows are heavy, and so you're overusing your forehead muscle to try to lift those brows. And so this is a very common area requested to treat, but also can be a little bit tricky. We can also treat crow's feet, or the lines that develop around the eyes from smiling. We can also treat these muscles called the depressor anguli oris muscles, which contribute to that frown appearance on the face. There are lots of different areas on the face we can treat with neuromodulators. So what are neuromodulators? Neuromodulators come in a variety of different brands. So there are Botox, Dysport, Xeomin, Jeuveau, and now Daxxify. There are many options on the market. The one that's right for you will be a discussion between you and your injector or your dermatologist. The way all of these products work is they prevent the muscle from communicating with the nerve. So when your nerve is saying frown or squint, you're not going to be able to do that as aggressively. So you'll still be able to move a little bit, but just not as much to the point where your skin isn't consistently creasing when you're making that motion, like trying to lift your brows up or trying to squint or frown or scowl or even smile. So it's not going to affect your smile, but it'll affect how much you can kind of squint your eyes when you smile. And there's a way to place this product so the results look very natural, but over time, the magical part is you just don't develop those etched lines. It's important to note that Botox and Dysport, any neuromodulator, can take about 10 to 14 days to take effect. So if you're planning a big event like a wedding, or you want to get it for the first time, or you have a big date, just know that there's not going to be any significant change for a few days to up to 2 weeks. And so that's kind of a good thing about it. If you want to take the plunge, it might be worthwhile because it takes a little bit of time to set in. Pricing for neuromodulators varies dramatically between practices. Some people charge by area. So if you're having your forehead, crow's feet, and glabella treated, that would be 3 areas. So pricing is all over the place when it comes to that. They can also charge per unit. Now, if you go to a party or if there's an injector or some sort of special and they're charging less than $10 a unit, I would be very cautious and make sure that you do your research so you know the credentialing of your injector, because this product should not be that cheap. It should not be a deal. At the end of the day, this is your face we're talking about, and we don't want to make deals on a face. So you can go to downtown LA and buy a knockoff Louis Vuitton bag, and that's fine, but you definitely don't want to go to somebody's garage and buy knockoff Botox or Dysport and inject that into your face. This is your face, your health. There's blood vessels and complex things and lots of connections to the brain. So to put it But simply don't take a chance when it comes to your face, and with injections, make sure you go to a board certified dermatologist or a credentialed injector, and that's something that should be available to look up online. That's just a little caveat. I feel very passionate about making sure that you viewers are educated on who to see when it comes to doing procedures for your skin. The next R is restoring volume. It's all about restoring that volume. We talked about how the shifting of the bone and the fat pads in the face and even the changes in the muscle can create this long, sort of drawn appearance. In some cases, your face can look very hollow. So it's important to think about ways to restore volume, and that's where fillers come in. So fillers can be placed very strategically, naturally, to achieve a beautiful outcome, to replace volume that's been lost over time due to normal aging changes. We can place fillers in places like the cheeks, the temples, the jawline, the chin, and it's all meant to replace volume that's been lost or to enhance features that you have that have maybe lost a little volume or shrunk over time. It's not meant to make anyone look fake or doughy. I talk to people all the time who feel really uncomfortable about getting fillers because they've seen bad examples in the media, especially, or maybe with their friends. When we get into problems with fillers is when people don't appreciate or don't respect the anatomy of the face, the structure of the face, or they don't have the proper training to know where to place it so that you're actually replacing volume that has been lost rather than adding volume to areas that don't need it. For example, as I mentioned earlier, a lot of patients and a lot of you out there might be concerned about this line, right? The nasolabial fold, which is a normal anatomic line. But over time, as we explained with the shifting of the structures in the face, the shrinking of the bones, the shifting of the fat pads, the loss of collagen, this line can look more pronounced. And so the proper place to put filler is actually laterally, so in the back of the face. So if you kind of pull on your cheek like this, you have a really pronounced nasolabial fold, and you kind of give a little tug laterally, you'll notice that it softens itself. The last thing you want to do is put more filler in the fold because it can create this sort of platypus type, very full look in the front of the face, and that's really not addressing the reason why you're having deeper nasolabial folds. So that's just one example. There are a lot of intricacies we can go into, but at the end of the day, it's just so important to make sure that the person that you see to have these injections done knows the anatomy of the face and knows where to properly place it. So let's get back to fillers. So there are many different types of fillers. The most common filler used are in the hyaluronic acid category. So you might have heard of Juvederm or Belotero or Restylane. These are all hyaluronic acid-based fillers. So the nice thing about hyaluronic acid-based fillers is that if you just absolutely hate it, or God forbid there's a complication, you can actually dissolve these fillers. Now, it's really not what we want to do or what the plan is, but some people have peace of mind just knowing that they're dissolvable. The one thing is, if you are allergic to bee stings, you do not want to count on dissolving these fillers because the enzyme that dissolves hyaluronic acid fillers is called hyaluronidase, which is the same enzyme that bees use when they sting you. And if you get an exaggerated response to a bee sting or develop anaphylaxis, then you definitely don't want to be anywhere around hyaluronidase, which is what dissolves hyaluronic acid fillers. So that's something I always ask as a screening question with patients, is if they're allergic to bee stings, and we just need to make note of that so that if we wanted to use hyaluronidase, we definitely would stay away or steer clear of it with those patients. The other main category of fillers, so we talked about hyaluronic acid filler, the other main category are biostimulatory fillers. So the brand names are Sculptra or polylactic acid and Radiesse, which is calcium hydroxyl apatite. This category of fillers I particularly love because it's like the gift that keeps on giving. So you do need a few sessions of these fillers before you see and appreciate the natural sort of long-lasting results, but it's definitely worth it because, like I said, it tends to give you a really nice natural look, and over time will enhance the structure and volume of the skin, and they tend to last anywhere from 1 to 2 years or even longer. I've had patients who come in 5 years later for another Sculptra treatment or a touch-up, and that is something we see all the time. So if you want longevity and really natural enhancement, biostimulatory fillers are the way to go. Hyaluronic hyaluronic acid fillers also have their place. So, for lips, for under eyes, for tear troughs, you might want to think about hyaluronic acid fillers. But again, that's a discussion between you and your injector, who's credentialed, who knows how to counsel you on the right decisions to make. So fillers come in syringes. So a lot of them, especially the hyaluronic acid ones, are in pre-filled syringes. And so when you buy fillers, you're buying a syringe. Typically, they can range anywhere between $500 to $1,500. So there's a broad range of cost depending on what city you live in or the experience of your injector. And so just plan for that when you think about budgeting for these treatments. The next big category is resurfacing. So we think about resurfacing when it comes to the texture of the skin. So what is going on the skin that's a little bit deeper, not necessarily the canvas, but what does that texture look like? Are there fine lines? Are there deep lines? Are there a lot of red spots, a lot of brown spots that don't go away with just topical therapy? Are there scars? Are there traumatic scars, surgical scars, acne scars? So all of these things on the skin can be addressed with devices that will help with retexturizing the skin. Now, there are so many different devices out there, and it's way too much to go into in this video alone, but we will definitely get there, I promise. But the broad category are lasers, microneedling, radiofrequency microneedling. All of these things will help to resurface the texture of the skin. Typically, when we're talking about scarring or deep lines or surgical scars, it's going to require a series of treatments. So I would just remember that it took years for these scars and textural changes to occur. So they're not just going to be gone with one treatment. Everything has a timeline to it, and it's not a sprint, it's a marathon. And so if you're looking to help with the texture of your skin and really resurfacing, retexturizing the skin, it's a little bit of a process, but it is totally worth it. And this is one thing that does not at all change the structure and shape of your face. It's your skin. It just looks smoother, clearer, more radiant with less textural changes. And so if you're really hesitant to do any cosmetic procedures, I would 100% start with some sort of mild laser procedure like a Clear and Brilliant, or even microneedling, which is not a laser, but microneedling, or just something to kind of stimulate collagen and get your skin going so that you can experience one of the benefits of the many anti-aging treatments we have out there to offer you, because this one definitely doesn't change the way you look at all. One thing I should mention too is that chemical peels will also help restructure and resurface the skin. There are a number of different types of chemical peels. Typically in the day-to-day office setting, we will use superficial chemical peels, which don't necessarily help to address things like acne scars, but it can definitely help with pigmentation. And if that's something you'd like to hear more about, definitely drop it in the comments below, because I'd be happy to talk about chemical peeling as a category on its own. So far, we talked about repairing sun damage, relaxing those muscles on the face to prevent the development of fine lines and edge lines on the skin. We talked about restoring volume with things like hyaluronic acid and biostimulatory fillers. We also talked about resurfacing the texture of the skin with various devices, microneedling, chemical peels. Lastly, we're going to talk about redraping, or I call this category redraping or tightening the skin. And we can do that with a number of different devices. Another wonderful treatment, because there is no downtime and really no evidence that you had anything done other than a few months after the treatment, your skin just looks tighter, almost like it was shrink wrap. And so this is what we want to do early on. So as early as the middle of your third decade or into your fourth decade, we want to start maintaining the structure of our skin with skin tightening treatments like ultrasound-based therapies or radiofrequency-based therapies. I personally love a device called the SoftWave. It's ultrasound-based technology. You can have this procedure as often as every 3 months with really nice results, but I recommend it more practically to patients yearly or twice a year to help redrape and tighten the structure of the skin. Now, if you've had a facelift in the past, or you're kind of thinking down that road, then this is something you would use post-procedure to help maintain those results as well. Because even after a surgical procedure like a facelift, you want to maintain that collagen, that elastin, so that you don't have to go and redo it 20 years later. later. So Soft Wave is the way to go in this category for me. It's an ultrasound-based skin tightening device. Like I mentioned, the treatments take about 45 minutes. We typically treat your entire face and neck so that we can capture that jawline and under the chin area, or we call it the submental area. And it's a really wonderful treatment to help with skin tightening. So now we've covered the 5 R's of anti-aging treatment. We've gone over the science of aging skin, what happens to our skin as we age structurally, and how we can prevent and also address the signs of aging in a natural way so that we just look as great as we feel and so that you can be the best version of you. If you've watched this far, thank you so much for tuning in. Make sure you like and subscribe below and stay tuned for more videos. Let me know what you want to hear about next.